And a good morning, this is Dr. Lieven speaking to you from Vila Moura in Portugal, and I want to give you a next update on my health condition, specifically regarding the loin rupture, or as they call it, an inguinal hernia. And several things have happened since I gave you the last update, which really have all positively contributed to what I believe right now is the wisest decision to make. Just as a quick recap, but I will put the link to the previous video that I made where I go into a bit of detail, not gory detail, but to help understand what specifically is going on. So normally we have our belly. Inside our belly is obviously our intestines and male or female organs, the kidneys, the bladder, and all of that is held in a sheath at the bottom, sort of a skin. It's ligament. It's actually made of collagen. I've learned this now from Dr. Sosa, that at a particular point, men in particular can develop weakness, and this is a very typical region here or on the other side, where the wall, the abdominal wall, which is, skin, interior skin, which is layered with fat, and then here is this sort of abdominal wall. Well, you can rupture that, and you can go, in my case, I have gone in for a sound imaging echography, which they use on babies as well. I mean, on pregnant women to see the babies, and they did measure that the little hole is 1.5 centimeters large, which is small. I had thought it was about €1 in size, or a quarter in US dollars. So I was fairly accurate in what I had felt myself in terms of impression, but to then have it imaged. Based on that imagery, I ended up with the appointment with somebody who's now become inevitably an important person in my life, a person of interest, as they say. Hold on, I'm trying to find the image. Let me pause the video for a second. This is who I wanted to show. This is a group of private hospitals here in Portugal, and I have previous Thursday evening, had an interview with Dr. Paulo Vieira de Sousa, who truly, and I, those of you who know me personally know that I am definitely, recommend avoiding any surgery of any kind if you can heal it naturally. You should avoid any medications if you can function without it. However, I'm not a radical person. In natural medicine, you have to be reasonable that what is possible and attainable, okay, go for it. I'm a cancer survivor myself, and I did it without chemotherapy, without radiation therapy. It was not an easy task. Went through 12 different regimens to achieve this, and it took about 3 years to end up with eventually an even better immune system. Now, I've gone through another experience which actually deals with the hospital. Let me pull this up here. Voila. Right there you can see what is referred to as the hyperbaric oxygen chamber and hyperbaric oxygen therapy. I ended up in there, and I'm gonna make a video separate to this. That will be a video that may shock a little bit, because I've come a long way from having suffered with dry feet and dry hands, inside of my feet and the bottom of my feet and the inside of my hands, which truly ended up being quite painful. And you know, when you look at the heel here, you see anyways, I ended up trying to resolve it with aloe vera, and ended up with first-degree burns, then second-degree burns, and eventually third-degree burns. And it was precisely the hyperbaric chamber in this hospital, private hospital. This is a machine of over €1 million, in which I've been treated to essentially force oxygen into the body, which has resulted into eventually a closure of the wounds. Yeah, it was pretty gory at the time, and I think, let's see here, let me jump to this. See, this is where, thanks to the oxygen, how the wounds began to close, and that is pretty remarkable to experience that. I not only had this on my feet, but I also had it on my fingers, and at times this would be bleeding. These would be cuts that would appear by themselves. This is me. I'll show video of this, of me receiving this treatment inside the hyperbaric chamber, but all of this happened at this same private hospital, and so that all has resulted into me not only meeting Dr. Paulo Vieira, but to actually develop quite, I'm impressed with him. He is very much specialized in 3D minimal invasive laparoscopic surgery. That means they go in with cameras, and so it is one of his specialties. He's a man that has many different attributes in his resume, but above all, and I thank God for this, because the meeting, let me share a small detail, because often the connection of trust is made in details. My appointment was at 7:45 in the evening, which I considered fairly late, but it was, I was there on time, but there was a bit of delay. He was busy with 2 more patients ahead of me, so by 8:30 in the evening, I finally met Dr. Paulo for the first time. And I immediately told him, I said, Dr. Sosa, you guys are working late. I had no idea that the clinic was open that late. He says, there is one more patient after you, and then I need to go to our hospital in Faro to do an emergency appendix surgery. Appendicitis surgery. So, but I responded, I said, Doc, reschedule. I'm a neighbor here, you know, so please attend to the emergency you need to deal with. He says, no, the man is taken care of. He's being prepped. He's at ease. He's in comfort. You're here, this is your time. Please take all the time you need to ask all the questions you would like to ask. Look, the little hairs come up on my arm. You don't get that too often in the medical field. You know, one of the statements I've heard by thousands of patients is, my doctor doesn't have time to even listen. So he was the opposite. He shared about a half hour in which he made drawings and explained. That's another thing. Rather than talking cute little Latin terms, which would have proven maybe to other people that he was smart and I'm dumb, he explained in understandable terms. One of the most important things, let me see, is it here? No. Just a second, I want to go back to the image. Yeah, this thing. he compared this to a hole in a sail. I asked him if he had experience with somebody who would have been able to heal this naturally. And I have found a few people on the internet, but very, very few. It is so that typically in the end you need surgery even after having tried. Now he indicated that there is people who live their entire life with this, but there is a risk of if these cells that bulge out end up inflaming, and worse if they begin to do necrosis, which means that the cells begin to die off. You don't want that. Nobody wants that. Yeah. So he didn't scare me. He informed me about stuff which some of it I already knew, but I'm delighted. I want to go back to him right here. Delighted that we had this conversation where he let me exhaust every question I had, and I was practical but very specific in my questions. He gave me non-evasive answers, very specific. He told me, he said, listen, if you want to try a month or two to try to fortify that that stomach wall, which he explained is collagen, feel free to try. I don't have experience with it myself, but you're welcome. You know, you're not taking a big risk. The only thing is it's uncomfortable. You'll have to lay down, and I know that's exactly what I've been doing in the past 2 weeks. I've been 90% laying down. I mean, even in my living room there is a bed, or a table for me to lay down. And anyways, based on this connection, my respect for him as a technical wizard, as a intelligent person, as a calm, communicative person, I feel at ease with him, and I have sent him the message already, in which I don't know if I can pull it up here. Yeah. Right here to Dr. Paulo. I send him the message. Good morning, Dr. Paulo. This is Dr. Lieven here, the person from Belgium with who you met on Thursday evening. Several factors, let me see if I can bring this over here. Yeah. Several factors have contributed to me feeling 100% comfortable to trust my health into your skilled hands. Based on this, I have decided not to experiment self-healing. Instead, I would like to proceed, because the self-healing is minimum 6 weeks. It may be as long as 6 months before I would have enough sturdy results. And honest to God, laying down that long, I don't know if it's exhausting. Instead, I would like to proceed with the surgery. There's 2 more small issues regarding my digestive situation, an old issue related to my right testicle. I'm not going to get into details here, but please advise how to proceed. Well, guess what? 9:54. Okay, this morning. 9:55. I'm starting surgery now, call you later. My friends, how many people do you have as a surgeon who's standing there ready to do surgery, and yet who responds that he will get back in touch? And I send him thank you. So this is it in terms of where I'm at today. I will update you once dates and schedules are made, and well, this is it. I think several people have mentioned, they can hear in my voice that I'm tired, exhausted, truly. I'm thankful at the same time. I do feel that God's been guiding me, put me in the right place, with the right person, with the right organization. This is an extensive hospital group. They have as indicated, very specialized equipment. Laparoscopic means they go in with a small camera, then with the robots, and they begin to do, instead of a longer than 5 centimeter wound, it's a less than a centimeter cut that they do to insert the camera and all the robotics. The recovery is going in and pretty much, in most cases, being able to go home the same day. He even mentioned that this is not regular, however, that he had a footballer who had the surgery done and a week later was actually already back in training. So the prospects of all of that is very good. I'm delighted with that, and I will update you in the next step. Thank you for letting me share this, and again, good health to all of you. We will all learn from this, and as they say, whatever doesn't kill you makes you stronger, right? God bless everyone. Thank you for letting me share this.